Good morning, everyone. My name is Damon Johnson, and I am the program manager for Georgia AIDS Education and Training Center. We're excited to have each of you on the call today. And what we'll be bringing to you today is a conversation and a environment that we're going to talk to long-term survivors about their experiences during this COVID environment. We have a dynamic panel that will all speak from their perspective and their view. And what we ask is that you please usher your experiences into the room by utilizing the chat box for feelings, comments, and or questions. But if you have questions, we prefer you use the question and answer box so that we can make sure those questions are answered swiftly and on this call. We want to reserve a lot of time at the end for question and answer. So please feel free to jot down questions. Don't feel afraid to ask a number of questions. We're here to answer those questions and to put you at ease. I'm going to pass the baton over to our esteemed host, Larry Scott Walker, who I can't thank enough, who's been a great partner, awesome partner, and he'll take it from here. And we look forward to you all participating. Thank you.
Greetings, everyone. It's such a pleasure to join you all again for this Built to Thrive long-term survivors and COVID-19 conversation. I'm Larry Scott Walker. Again, I'm the executive director and co-founder of Thrive Support Services, an organization that provides support, linkage, advocacy, and power building services for people living with HIV, more specifically, Black gay men living with HIV. Just a few housekeeping, just one housekeeping rule for today. I want you all to be very mindful to be good to yourselves, listen to your bodies. If you have to use the bathroom, please do so. If you need to get a bite to eat or something to drink, please do so. Please focus on your own self-care, as well as to send some amazing energy and peace and love to the presenters that are coming before you today. This conversation is sponsored by Thera Technologies. We would like to thank them for convening this space for such an important conversation. Today, we will have a panel of amazing individuals who all represent different networks and experiences as long-term survivors. Going in the order of the person who has been living with HIV the longest, we will hear from Antoinette Jones, peer specialist here in Atlanta, Georgia at Sister Love Incorporated. She's been living with HIV for 25 years. We'll then hear from Malcolm Reed. He's the Silver Lining Project Manager at Thrive SS Incorporated here in Atlanta, Georgia. He's one of my own. I can't wait to hear from Malcolm Reed. And then we'll hear from Miss Freda Jones. Freda Jones is the founder and executive director of Lotus. She's gonna say loving ourselves through something. She's gonna tell me what the acronym stands for. I don't want to butcher it, but Freda Jones is coming with a wealth of information coming from her network of 300 plus Black women living with HIV in Atlanta. So this conversation, this Built to Thrive conversation, is building on the first two presentations regarding COVID, the Stronger Together conversations. If you have joined those, you know what I'm referring to. And if not, there are videos if you want to catch up on those. These are some of the voices from the community. How can we better support the long-term survivors amongst us, who in some cases are starting to encounter PTSD-like feelings from early days of the epidemic? Oh, someone said they have no sound. Can we please confirm that everyone can hear me? Hello? Can someone on the team confirm that we can be heard?
Yep, we can hear.
Okay, thank you. I will hold up that a person said they don't have any sound. And that's a thing that has come up a lot for people who are long-term survivors with HIV or people in the HIV movement. A lot of these the feelings, this past traumas of having dealt with and experienced or even heard of the deaths that have occurred. Is someone trying to say something? Another quote, "I'm living with HIV plus COVID-19. It has been horrible. I did not think I was at risk until I got sick. Can you please address more stigma?" The first section in this conversation today, as we will see, deals with stigma, both the stigma of being people living with HIV, as well as the stigma that is beginning to emerge around this new virus. I'm a long-term survivor. I'm deeply concerned. How do we as long-term survivors make it through? It's double stigma. Again, we see stigma held up. We're using this quote. We're using this quote to kind of frame our work today. Our shared vulnerability to this virus is a source of our solidarity. We must remember that the virus, not people with COVID-19 or affected by COVID-19, is the enemy. If you agree with that, please put, amen, ashe, I agree. Totally agree in the chat box. We want this to be a very interactive experience as Damon put forth earlier. We want to invite you to share of your experiences. We understand that we are the panel represents their experiences, their lived experiences, their work, their passion, and that does not mean that all people living with HIV, especially long-term survivors, all feel the same way. So because we expect that there's a diverse mix of hundreds or thousands of people looking at this webinar right now, please put your information, your experiences, your suggestions into the chat box or the questions into the question and answer box so that we afterwards can compile them and actually build training and other community community engagements around them. Thank you so much in advance. Today, our agenda includes, first we'll tackle stigma and managing anxiety during this COVID crisis. Then long-term survivors and trusting the system. Over 50 living with HIV and the impacts of COVID-19. Black women, COVID-19, and HIV. And then we'll revisit the Department of Health and Human Services guidelines, practical advice for people living with HIV. Stigma. We often hear the word, but here's a definition that we're working with, and here's a definition of stigma. Stigma is a pervasive social process. Individuals with socially undesirable attributes or identities are seen as having lower social value than are others, and as a consequence face prejudice and discrimination. If you're a person a marginalized person who has lived within the margins, you understand stigma. People living with HIV understand stigma. People of trans experience understand stigma. Black people understand stigma. People who are differently able understand stigma. And hopefully by the end of this conversation, you will understand greater the stigma and how it impacts us. These are different forms of stigma. We talked about racial stigma, poverty, disease state stigma, sexual orientation stigma, gender, level of education, immigrant status, and any other characteristic viewed as a sign of a flaw or inferior characteristic. So stigma operates in several different ways. There's the stigma that we ourselves feel, that self-stigma, stigma by association, right? And then there's also public stigma. But then we all operate within systems of structural stigma. Here on the screen, you see a definition of structural stigma as the macro level. It says structural stigma at the macro level refers to attitudes in societies, practices, structures, services, and the laws that work to the disadvantage of minority groups. Ashe. Here we see the likely manifestations of stigma related to being a person living or even at risk for COVID-19. And these are some of the things that may come up. Increased anxiety, finding yourself excessively checking for symptoms. Oh my God, what's that scratch in my throat? Becoming irritable more easily, feeling insecure or unsettled, fearing normal allergies or coughs, again, or might be related to COVID-19, experiencing bouts of sadness, feeling helpless or lack of control, or difficulty concentrating. And we understand that this is not a comprehensive list. And as such, I invite you again to comment within the comment box some other aspects of negative aspects of stigma that may come up or rear its head during this COVID crisis. Intersectional stigma. Intersectional stigma relates to the stigma, the multiple layered stigmas that we experience as people. So, an example of intersectional stigma would be myself as a person living with HIV. But not only am I a person living with HIV, I'm also a Black man. I'm also a Black gay man, and many of my identities, if not all of them, come along with some form of prejudgment or potential oppression, and that's at multiple levels. So if we're going to address stigma or going to address people in general, we must address them in an intersectional way, understanding that in many cases, in most cases, multiple of our identities are marred with some form of stigma. But here's the good thing, that experiencing stigma and hardship often fortifies us. It builds us up. It builds our resiliency. You might find that I can adapt to changes when they occur, or I can deal with whatever comes my way, or that you try to find the humor in things that you face as problems. This is a list here of statements that reflect those resiliency points that we build, that resiliency, that scar tissue that we build around our hurts and trauma. I invite you to read through them. I also invite you to put some affirming statements reflecting your own resiliency into the comment box, because this is meant to be an interactive experience, and I would love to see some of the affirming messages that come up for you. So here's how we manage our anxiety. I want you to take a good slow look, not lick. Please do not look at your screens right now. A slow look at the post-its that are on the screen. These are some things that we can do to mitigate and manage our anxiety points as they arise. Watch your self-talk. Optimism can be learned. So don't spend a whole bunch of time talking down to yourself, being mean to yourself. As I said, the one rule for today and every day is that we be kind to ourselves, gentle to ourselves, treat ourselves like we know that we deserve to be treated. Stop scaring yourself. Yes, COVID is novel and scary in many ways, but that doesn't mean that we should just be existing in a space of fear that oftentimes inhibits our rational mind. Find internal reassurance. That slide before, those beautiful statements that you're putting into the chat box right now, use them to build up yourself. Create new outcomes in your fantasy. It's a beautiful, powerful place to put yourself into your vortex of creation by focusing, allowing yourself to daydream and to see the future that is definitely destined to you if you keep at the work that you're doing. Change the channel. Yes, COVID is new and scary, but it's new. The information that's coming out, new information is coming up out about COVID every day. But that doesn't mean that it's coming out breaking every second. It's not your responsibility to watch every hour of MSNBC or CNN or any other news aid station that's talking about COVID. Give yourself a break. Again, prioritize your mental health and self-care. Reach out, reassuring thoughts. This is a time that we're all experiencing some type of isolation, some type of physical distancing, and we're all experiencing some form of angst or isolation, or some of us at least. Reach out to your friends and loved ones. This is a frightening time for us all, and this fear is a normal reaction. And when we're in times where our fears are spiking and our anxieties are spiking, it's good to check in with a loved one to help one another to quell those fears and anxieties. Flash back to the early days of HIV and the experiences that were happening to a lot of us. Learn from those lessons and the mistakes and missteps, the stigmas and that have hurt our community. Learn from them and use those tools in this time. Understand that a lot of us will not contract COVID-19, and for the people that will, very less of them will actually succumb to this. I'd understand that that doesn't mean that, you won't feel any type of natural anxiousness or anxiety in this moment, but understand that. Listen to the professionals. There's the steps. Understand that there are steps that you can take to protect yourself, and we're going to go over a lot of them in this talk today. And if you're still worried or need some additional help, please let us know in the chat box. Understand that many of us are feeling sad, confused, lonely, in need right now, and you're not alone. So again, reach out to your people, your loved ones, and talk through your feelings. If you are don't have friends or family to talk to, definitely reach out to some of the professionals on this call who can link you to therapy services and support services in in your area. And again, remember, we're resilient people, and resiliency is not just another pretty R word. It's who we are. We've made it through so much to get to this point, and we will make it through this. It is with honor that before we go into this next presenter, again, if you have any questions about what I just presented or want to share out your experience, we invite you to do so in the chat box. And if you have any questions, again, please put those in the Q&A section. It is with honor and pride that I introduce this next sister, this long-term survivor, this HIV warrior. Antoinette Jones has been living with HIV for 25 years, making her the longest survivor on this call today. And subsequently, she is the youngest person on this call today. She brings to this conversation a fresh experience, her experience as one of the ladies who prep speakers for Georgia, her experience as a sexual health and disclosure counselor and trainer, her experiences as someone who has written policy briefs to challenge HIV criminalization, as well as sex work, as well as criminal justice reform. I love this sister, and more than that, I thank this sister for being and sharing with us today. It's without any further ado, I bring up Antoinette Jones.
All right, Larry, with the best introduction, I'll be over here crying. I really have to bring up my fan because I'm oh my gosh, crying. Okay, I really appreciate you, Larry, and AETC for having me here to present. Oh yes, thank you, Larry, and thank you all. So my name is Antoinette Jones. I am an HIV peer specialist and navigator and advocate in Atlanta, Georgia. As Larry said, I work at Sister Love Incorporated. Can everybody hear me? I hope I sound good. Thumbs up if I do.
I can hear you, Antoinette.
Awesome. Okay. So just a little bit about myself. Thank you. Thank y'all. A little bit about myself is like Larry said, I'm a long-term survivor of HIV. I have been living with HIV my whole life, 25 years. I just turned 25 in December. Whoop, whoop. Shout out to all the Capricorns out there. And I began my advocacy journey by starting my job at Sister Love as a peer specialist. I've been with Sister Love for the past 3 years. And that's really where, whoo, Larry done got me started, child. That's where I became empowered to do this work and to facilitate access to care and for people like myself, Black women, marginalized folks who don't have access to care. And I just spend majority of my advocacy sharing my story. Thank you. I just spend majority of my advocacy sharing my story and empowering other young people and Black women living with HIV to use their voice to make change and to bring us together. My bio, if you can read it, it says that I was born in a serodiscordant family. I was adopted as a baby. I often felt alone as a child, so isolation is not new to me. It's something that I'm very familiar with. And some of my positive experiences while living with HIV and aging in the medical system are the professionals who actually helped me on my way. And thank you, are the professionals who helped me on my way and helped me manage my HIV diagnosis. And that is what made me really drawn to advocacy and really wanting to help others and make sure people are remaining in care. So next slide, please. All right, so some key terms that you may have seen on the previous slide is serodiscordant, as I mentioned. It just means that someone who is the only one of something and someone else is not. So like in a serodiscordant relationship or family, it's like a mixed status relationship. So one person in a relationship may be living with HIV and the other partner is not. And it usually happens in situations like mine where someone will adopt a child who's born living with HIV. And then long-term survivor. So oftentimes people see me and they see that I'm young, that I'm a millennial, that I'm a youth, and they're like, how are you long-term survivor? And I have to explain to them, yes, I was actually born positive. I was diagnosed at birth. I have been living with HIV for 25 years. HIV is all I know. So I am considered a long-term survivor. We don't see much research around people who were born positive as they are aging with HIV. A lot of the conversation about aging with HIV is for those who are 50 and older. Nothing wrong with that, but we just want to make space during this time to bring awareness to people who are born positive and are thriving and are still living and are aging with HIV. Next slide. So some things that you're going to receive from this, my little portion on this webinar, is I just want to bring some awareness to folks who are left out of the conversation. So the vertical or perinatal, I would use those terms interchangeably. They both mean the same thing, being born positive. Women and young people, the fears that we have around COVID-19, some history and mistrust for women living with HIV and some long-term survivors mistrust, medical access and fortifying the healthcare system. And before we move past this slide, I just want to say that this PowerPoint, my presentation is based off of my personal experiences as well as the experiences of my peers and the people who I interact with on a daily basis who are living with HIV. So, next slide, please. So getting straight into it, some similarities that we see between HIV and coronavirus. We know that coronavirus and HIV are both blind to the eye. We know that it's a tricky and difficult to understand virus, hence why there's been a lot of question in the HIV community around like, how can they already be working on a vaccine or cure for corona? And we've been doing this for the past 30 years and we don't have a vaccine or we don't have a cure yet. And it's because both of these viruses are very tricky and complex in their own way. So they both, we must take precautions to prevent the spread of both of these viruses, we know. And both of these viruses come with a degree of stigma, as was mentioned by Larry in the previous slide. So we have to be prepared for that stigma. We have to know how to combat it during this time. So next slide. So why is it important to remain in care during this time? We already know that HIV infects, takes over, and kills the CD4 cells. We know that the CD4 cells are the very cells that we need. They are a defense mechanism. They are a first line of defense, and they keep us healthy. So we want to make sure that people who are living with HIV are remaining in care, that they are remaining virally suppressed, and we are doing the reverse of what's on the slide. So this is the infection outcome for someone who is not virally suppressed, who is not in care, and not adherent to their medicine. So of course their viral load will increase, and they cell count will decrease. The T4 cell count will decrease. And we want to, of course, do the opposite of that. We want to make sure that their viral load is as low as possible and their T4 cell count is above 200. And all people living with HIV, especially those with advanced stage HIV or AIDS, as some may remember it as, should remain cautious and remain in care. And next slide, please. And actually, thanks to Larry and ATEC, this is the first time I've heard of this term. So V equals V is very similar to U equals U, which we were talking about further in my slides. So V equals viremic equals vulnerable. So poorly controlled HIV provides unacceptable unknown risks during this pandemic. So we want to make sure that, like I said, we're staying virally suppressed. Viremic equals vulnerable. It just means that you're making yourself more vulnerable to other infectious diseases and conditions that are out there in the world. And infection outcomes for people who are not virally suppressed, we want to make sure that we're staying away from this. So next slide, please. So just some food for thought. This is a quote that I actually saw on Paz magazine. It's from al.com, and it says that people with HIV or advanced stage HIV has a less likely chance of receiving ventilators at the hospital if they test positive for coronavirus. According to the state's criteria for medical ventilator triage, following proclamation of mass casualty respiration emergency, these conditions include mastocytous cancer, advanced stage HIV, end-stage liver disease with MELD score of over 20, severe mental retardation, advanced dementia, and severe burns. And I don't know about you all, but when I saw this, it really like raised my eyebrow, made my spirit very uncomfortable, knowing that if somebody is not virally suppressed or does have AIDS, they may be the last to receive a ventilator or not one at all, or have a ventilator taken away from them. And it's uncomfortable. It's not good to know. So with this being said, for my personal experience, I know that for me, for myself and my peers, I want to encourage them to do any and everything that they can do to get to undetectable viral load, remain in care, and to make sure that in case anything does happen, we are doing everything that we need to do to take care of ourselves so that we can survive, you know? So next slide, please. So what are people living with HIV fears and challenges during COVID-19? One being just access to medical services. We've seen a lot of questions on social media, Facebook, webinars where people living with HIV have been asking over and over, how does COVID affect people living with HIV? How would it affect people who aren't virally suppressed? How would it affect those who are? Anybody who's immune compromised, how is this going to affect us? We need data, we need to know, we need answers, and we need them now. So with all that, of course, we have all these fears going along with that. So just access to medical services, like I said, not being seen by our provider, not being able to receive our medicines, not knowing if signs and symptoms are related to COVID. I know for me, that was my main thing. I did travel before all the COVID stuff started happening. I went to Savannah and I was real sick, and I was like, is this just a cold? Is this COVID? Somebody tell me, I need answers. But then I went to the doctor and I told her my symptoms, and she was like, you're fine. You're just having a cold. Change your weather. You're good. Go home. Take precautions. Do everything that you need to do to remain healthy. Effects of isolation on mental health and behavior. Like I said in the beginning, I'm really familiar with isolation, but it's still something that I have trouble with and I'm working through. So COVID can increase my isolation anxiety and increase my mental health. So what I did for myself is I had a therapist that I actually lost in transition, but I was able to reach out to her and ask her if she can work with me during this time to better control my mental health, better shape me during this time, specifically while I'm at home, working from home, spending my days in the same room, and I need help. So she was able to do that. Also, some other fears, media manipulation, trying staying away from social media, all types of medias, anything of the sorts that could give us some false information that can make us believe that is true, that it's happening. Fears of housing. Of course, we know that people living with HIV are losing housing at this time with everything that's going on in Georgia, and the housing program, the HOPPER program. So we do have people who are living with HIV who are homeless and who are losing housing and who have a fear that once they go out or once they are out in the world living on the street, it makes them at a higher risk of contracting COVID. And then loss of a job, employment, income reduction. We know this to be true today. A lot of people have lost their job, can't make ends meet, are having trouble with food and all types of stuff, and that is a real fear. So I know for me, I'm doing everything I can humanly possibly do, trying to grab as many resources as I can possibly do, working at Sister Love, working with different organizations to provide resources to my peers and to the people in the community who have experienced these different issues. So next slide, please. So, how COVID-19 pandemic can increase the internal and external stigma towards people living with HIV. We talked about stigma at the beginning of this PowerPoint. Um, so we know that people living with HIV who do contract COVID may receive higher discrimination. Um, and there's a fear of not being able to get hired or return to work after COVID diagnosis. Wearing a mask does not mean the person is ill or living with COVID-19. Um, I know since I've been out, I've coughed 1, 2 times, and that's 2 times too many for many people. So, so of course, people will look at you like you crazy. Like, hold on, you got a 3 cough maximum. Don't do it to yourself. So, we want to make sure that just because I'm wearing a mask, understand that I'm trying to protect myself, and I'm trying to protect you from me, or vice versa. So, don't automatically assume that I have this mask on because I have COVID. Believing that only African American people contract COVID or HIV, and a fear of returning to a normal social life or casual contact. So that's a big one for me because I do work at Sister Love. Like I said, we do offer direct services of testing and counseling, and we see about 15 to 20 clients a day. So that is direct interaction, close interaction, being in close proximity to somebody that you don't know their social life, you don't know what they've been doing outside of the walls of your organization. So that is a fear, you just do not know. So I have to protect myself, get my health in check, and take the precautionary measures that I need to take to prevent that from happening. Conspiracies about the government has increased, of course. I'm a conspiracist, but I'm not going to dive too deep into that. But we know that it's an increase going on. Providers refusing care to people living with HIV during COVID-19. This may not happen. Of course, it's unethical, but it does happen. Providers can be discriminatory towards people living with HIV. And then referring to people by their diagnosis. We've seen it a lot in the HIV community. Oh, you got that shiz, you got the package, HIVers. And now, of course, we nickname Corona to Rona. We want to make sure that we're not identifying folks who have contracted Corona, who are living with Corona right now and trying to get healthy, as folks who have that Rona or something like that. Oh, you got that Rona, et cetera, et cetera. So we want to try and stay away from stigmatizing language like this, for the sake of people living with HIV and those who have had a COVID-19 diagnosis. So next slide, please. So when it comes to mistrust and how we talk about mistrust and where it comes from, where it stems from, and why I'm such a conspiracist today. So here's some mistrust that we see in women of color and Black women specifically. So we know of some forced and unknown sterilization in Black women, Latinx women, and Native women. There has been a history of that. We know that Black women who report rape or sexual assault are less likely to be believed. We know that there is a higher rate of infant mortality in Black babies. We know that Black women have been sexually exploited and hypersexualized, which causes a range of issues around mental health, self-esteem, and acceptance. We know that there are false assumptions that our bodies can withstand more than any race, and that stems from slavery time till now. And then we know that we have had to advocate for our needs and issues around our healthcare and our reproductive justice. Um, so a little bit about having to advocate for our needs and issues. I know for me, I've had to advocate for the past. I've been in Georgia for 4 years, and for 3 years, I've had to advocate for to my provider the fact that I wanted to switch a med, and the provider who was a male and very egotistical, assumed that because I kept saying that the meds was not working for me, that I was not taking it and wasn't adherent versus the fact that no, I was just that med regimen that he had me on, which was a one pill, was not working for me. And it was just a back and forth with him and with that provider. And I don't feel like us as people or women living with HIV should have to do that. Like if I express to you that something is not working and um and I think we should look into this more, you should acknowledge my concerns and abide by them and switch me off of the medicine and then see how that works. So that's just an example. And next slide. And then some more mistrust that we see today, lies from people in position of authority. We see it over and over on the news. A lot of contradictory going on. Not releasing some race data about COVID-19 to the public. You know, we've been asking for a lot of data around how this impacts Black and Brown communities, specifically marginalized folks. And then little data information about the risk of COVID on people living with HIV. Like I've said before, people living with HIV, we want answers and we want them now. Next slide. Some more food for thought. We love food. I'm hungry right now, obviously. So not everyone living with HIV is immune compromised. So those with access to proper treatment do not have higher coronavirus risk. Because of the disparities that exist in both access to HIV treatment and STI testing, marginalized communities are disproportionately impacted by the spread of HIV. It has been said over and over in slides, PowerPoints. Y'all, this is nothing new. This is not new information to y'all. And if it is, please pay close attention. But knowing barriers to their status. The majority of people with HIV who are not being adequately served by our healthcare system are the folks who are Black, Latinx, transgender, and other marginalized low-income communities. So this is just a quote. And it just opens your eyes to the main key point in there that says access. So if we are living in rural communities where there's not a lot of access to providers who specialize in HIV, then we are probably not, we are probably at a higher risk. If we, um, if it takes 2 trains and 2 buses to get all the way to my provider, then that's not proper access and we are probably at a higher risk. If my provider does not offer a delivery service for my medicines, I am at a higher risk. So just knowing that and knowing the fears that come along with COVID-19, they pretty much go hand in hand. So we want to make sure that we are expanding the access to HIV treatment and STI testing, so especially for marginalized people. Next slide. So what can we do to do that? Have access to care services. I know for me, my new provider has, when the whole COVID thing started in March, she called me and she was like, hey, your appointment is in 2 weeks, but do you want to do it in a couple of days? And I was like, yes, because I don't know what's going to happen. I'm really concerned. I'm really worried. I want to make sure I'm okay. Let's do it. So she was able to move my appointment up by 2 whole weeks and see me and make sure that I was okay at the early stages of COVID. And she knows that I travel. She knows that I advocate, and I was in Savannah the week before. So she was able to answer any questions that I may have had. check on regular prescription drugs to make sure you have an adequate supply, refill if needed. She was able to give me a 60-day supply of my medicine. Some providers would give a 90-day supply. But because I was new at this facility, she was just like, I want to do a 60-day supply. And then when you come back, I want to see you again. And then I'll give you another 60-day supply, 60 to 90-day supply. So provider offices should have a screening process to reduce the chance of people contracting COVID-19 when being seen for appointments. So don't just stop appointments, of course, because obviously people live with HIV, have increased fears, increased anxiety, so they need to be seen. They want to make sure that they are not either asymptomatic to the COVID or do not have it at all. So just still see them, screen them, and just take the precautionary measures that needs to be taken to protect you and the patient. Implement a form of telehealth therapy if they don't already have. Because Sister Love, we are a community-based organization who does that direct services. That does not mean that just because we're working from home that we no longer want to see our clients. So we are implementing telehealth therapy into our everyday. And I think other providers should have that as well. Check in with providers if you have questions or fears, like I said, and providers check in with your clients who are at higher risk of falling off HIV regimen and has known mental health challenges. That last key point is very important. I was on a webinar and one of my peers was like, I never had a provider like call me and check in on me and make sure I'm doing good, like it's taboo. And it is taboo. I don't think it should be. Like, patients should not be the only ones calling their provider. It should be hand in hand, both of us. So, especially during this time of COVID. So, providers just, we know that you have a system with all of our information. Just take the time, go through your client portal, and call some of your clients just to check in on them, make sure that they're doing okay. Ask them if they need anything. Ask them some of their challenges. How can you assist? What resources that they need? And just be the provider that, you took the oath to be. So next slide. Undetectable equals untransmittable. We know it. We've seen it. We love it. So U equals you. So like I've said, staying undetectable during this time is your greatest chance of not contracting COVID or preventing the chance of you contracting COVID. And the ways to do that is very simple. You want to take your medicine every day. You don't want to miss a dose. Maybe do some things like use a pill carrier box or set a reminder on your phone. And my favorite, of course, is the buddy system, a pill check system. So that's just utilizing someone to remind you to take your meds. Pill check your peers. Also, Sister Love, we did a small campaign called #SL where I challenged my peers to challenge their peers and so forth and so on. That to take their meds and encourage their peers to take their meds and to get to undetectable viral load. If you not already, remain undetectable. If you are, and assist your friends. So we want to make sure that if you are someone living with HIV on this webinar, please call your peers. If you haven't spoke to them in a while, y'all don't work together, y'all don't see each other every day, just call them and be like, hey sis, hey bruh, hey Sib, how you doing? What you been up to? How are you taking your meds? How are you staying safe and sane during this time of COVID? Is there anything that I can do for you? Is there anything that you need from me? Etc. etc. And then pill check. That's all I ask. So next slide. And some tips to stay level-headed during COVID-19. If you're someone like me who struggles with mental health, this is some tips. And if you have some tips, please put them in the chat box because I am receptive to anything that you have to offer. And I love to spread knowledge and spread good light and energy. So want to do your research. So we know that knowledge is power, and the more you know, the more you can achieve. So do your research, ask your doctor questions, aim to achieve and maintain an undetectable viral load. Can't say it enough. But I do not damn the detectables. I want to make that clear. If you are detectable, and that is your prerogative, then that is perfectly fine, as long as you are doing everything that you need to do to remain safe. Join a support group and a peer group. At Sister Love, we have two support groups. We have Divas in Action and we have Art Therapy. We are moving them to a virtual space to better um, to better allow people to be a part of it. And then there are other groups that Ms. Freda can talk about, and Larry has at Thrive SS, so we will get more into that. Talk to your pharmacist about your medicines and how you can receive a 30 to 60-day supply. And seek mental and behavioral health services, as I mentioned. That I did. I found my old therapist on LinkedIn because, like I said, we lost contact. But there are a lot of therapy services, a lot of free therapy services happening right now. And now is the time where if you need the resource, excuse me, then to reach out to anyone on this call and let them know that you are in search of maybe a free behavioral health therapy services or support group. So, and we can assist you with that. And next slide, I think that was the last one. No. Okay, so screen capture this if you are on your phone, on your laptop, take a picture, whatever have you. But you can also find this on Sister Love's website for our tips to preventing a COVID-19 infection. Things that have already been said, many come from the CDC. You want to make sure you wash your hands, avoid touching your eyes, nose, face, and mouth. Clean and disinfect frequently touched objects and surfaces. Use alcohol-based hand sanitizer with at least 60% alcohol. Avoid close contact with people who are sick. Regularly clean your work areas. So when you do return to work, you want to make sure that you are cleaning, especially if you work at a community-based organization, nonprofit, ASO, and even when you are home. I try to disinfect every day. As much as possible. I am a real germaphobe, so I try to clean and disinfect at least my work areas and stuff that I am physically touching every day. Stay home if you have any symptoms of acute respiratory illness. Check your regular prescription drugs to make sure you have an adequate supply. Can't say it enough. Take your medicine as prescribed and try to physical and social distance. And next slide. And that's all I have for y'all. So once again, thank you for allowing me to present. Thank you, Larry. Thank you, everyone with the Greater AIDS Education. And it was a pleasure. So.
Yes. Thank you so much, Antoinette. It's an honor to do this with you, this work with you in general. And for everybody on the call, pill check, take your pills. If you take a pill for HIV or any other ailment, and you're scheduled to take that right now, be good to yourself by taking your meds and making sure that you take your meds. Again, thank Antoinette. If you have any questions for Antoinette, please put them into the chat box. If you have any suggestions on anything that Antoinette covered for us to digest in this space that may help us to remain safe, sexy, and free. That's what I like to remain. I would like to remain safe, sexy, and free. The next presenter coming up, as I said earlier, is one of my own. He is my brother. He is one of my heroes. He is a member and an employee at Thrive Support Services. Mr. Malcolm Reed is a native New Yorker. I'm butchering the New York accent right now. But not only is he's the founder of the Silver Lining Project, which is a program of Thrive for Black gay men living and thriving with HIV over the age of 50. And thriving does not mean that you're undetectable, as Antoinette eloquently spoke to. We love detectables and undetectables. Malcolm is also the national policy advisor for the People Living with HIV caucus, which provides support and advocacy services for a lot of long-term survivors. Malcolm is an amazing brother and, like I said, a hero and a friend. And without further ado, Malcolm Reed.
I appreciate that intro. It's always nice to have a younger big brother. And I'm really happy to be here. And I thank the AIDS Education and Training Center as well for allowing me to talk to you guys today. So yeah, impacts of COVID-19 on Black men living with HIV over the age of 50. So before I get into that, I want to talk about our story. And This slide is titled Our Story, because why I do this work is not just about me. I do this work because I was blessed. My husband and I have been together for, I had a great job at AT&T, a nice house, a good life. But we had friends that were not as fortunate as us, and I had to do something. So one day I looked at my husband and I said, you know, I think I'm going to take the early retirement and I want to go to work to Thrive full time. And without a blink, he said, go for it. I had been Thrive since 2016. And here I started a group to support Black gay men living with HIV over the age of 50. And with the help of some other amazing brothers at Thrive SS that were in that group, we grew and became the Silver Lining Project. And I became the full-time program manager. Recently, just last February, experienced firsthand what the trauma of inadequate healthcare looks like. I took my husband to New York for Valentine's Day, and suddenly a romantic trip turned into 19 hours in the ER and 3 days in the hospital for previously undiagnosed diabetes. Our world was turned upside down since then, and he was back for quite a while. So we've been in quarantine long before the COVID crisis. The experience was quite harder. What would have happened if we didn't have insurance? And knowing that a lot of my brothers don't have insurance, that's what drives me every day. So when I think about the work we do at the Silver Lining Project, two things were abundantly clear with COVID-19. First, Black people are disproportionately impacted by COVID-19 due to our increased susceptibility to high blood pressure and diabetes, asthma, and heart disease. Secondly, the Silver Lining Project was formed to help older Black gay men living with HIV mitigate the feelings of isolation and depression. So what we did, we created a survey so that we could track the members of our group that were experiencing feelings of isolation. We also wanted to know what their comorbidities were. So the data could inform our programmatic plan. We created the social isolation due to COVID-19 survey. And although we created the survey for members of the Silver Lining Project, the questions are not just age and gender specific and not specific to sexual orientation either. The data is gathered as part of the survey. The survey itself can be used for anybody living with HIV. Next slide. Question in the survey, but after we got through the demographic information, the first question we asked is, have you experienced or been diagnosed with any chronic medical conditions besides HIV? And as you can see in this graph from this bar chart, 58% of the people who responded said yes, they were living with another chronic illness. And then we said, if yes, share what chronic medical conditions you're living with. And as you can see, 39%, 32%. Those were the two comorbidities. Well, we all know COVID-19 impacts, whatever word you want to use, those, especially those two top comorbidities. We also had one respondent that had been diagnosed with COVID-19. We don't know who that person is because the survey is anonymous, but we know he's in our organization and we assume he is doing well. 58% of the respondents, as I mentioned, had been diagnosed with a medical condition. And some of the other things that they were diagnosed with was pulmonary disease, such as COPD and emphysema, heart disease, And as I mentioned, one respondent tested positive for COVID-19. Next slide. The next thing we wanted to find out was the mental health status of our members. So we asked, are you living with any chronic mental health conditions? And as you can see, 30% of our members said yes. And then we wanted to know, okay, health condition. 36% of those people that responded to that question were living with depression. And this was going on. We formed the group to deal with Black gay men over 50 living with, dealing with isolation, dealing with depression. We knew in our minds anecdotally that this was happening. But now that we have the numbers, we can move forward and we can create some programs to help deal with that, besides what we are already doing. So those numbers for me. Think about 58% with chronic medical conditions and 30% living with a mental health issue. And that was when the pandemic started. And so what are we going to do? What were the main concerns related to those physical and mental health issues? We asked the question, if you answered yes to questions about a medical condition or a mental health condition, what concern about your situation? 51% that they had a concern, 18% healthcare, doctors, medication, and the ability to get needed services. You know, it's interesting. I live in Georgia, and I'm sure you've heard that, our governor was very, very slow to lock the state down and very quick to open it back up. What is interesting about how he opened it back up is he opened it up to bowling alleys, tattoo parlors, salons, hair salons, nail salons, but yet doctors and most doctors are still, their offices are still closed. They're doing telehealth. So think about, you can go get a tattoo, but you can't go see your doctor. So that's the healthcare and doctors and medication and the ability to get needed services was on a lot of people's mind. Vulnerability due to pre-existing conditions. As we mentioned, 39% had diabetes, 32% had hypertension. So they were also concerned that as the news comes out and says COVID-19 is going to impact diabetes and those with you can imagine the fear, the angst that was going through the folks in my group, and I'm sure folks all across the country. What that was the next three were concerned with isolation. 6 were concerned with a deteriorating mental health condition due to shelter in place. And the other 6%, and then with a current mental health condition. So we have Black gay men living with HIV in a group designed to protect them, to help them mitigate issues dealing with isolation, with depression brought on by what was going on in their life before COVID-19. Now COVID-19 comes along and you're told for your best health, you need to stay inside. You need to stay by yourself. And you live by yourself. So think about that. As I mentioned, our job was, we needed to look at this and find out that 20%, 9% plus 6%, that 20% of concerns for being isolated, for dealing with a mental health condition or deteriorating mental health condition, along with their physical, medical comorbidities. So our job is to do something about that. We had to look at isolation because we know that even though only 5% said that, you know, isolation was a part of it, if you dig deeper, we knew that there was going to be more there. So we asked this question. It was a multiple choice question. And sorry, go to the next slide, please. Can you tell us about the degree of isolation you feel since COVID-19 shelter-in-place orders went into effect? And the answer choice were completely isolated, more isolated than usual, isolated, or no change. But the answers were also based on time. So they answered completely isolated. It was, they had a choice of none of the time, once or twice, some of the time, most of the time, or all of the time. So when you put those two things together, 25% of our respondents said that they felt completely isolated most of the time. Responded that they were more isolated than usual, and 23% that they isolated most of the time. Almost 100% of the people that responded said that they were. Next. We have to do something, and before I get into the resources that are on this page, we knew that we had to do something. We knew that within our group, we had to take care of our members. So the Silver Lining Group had some programs that we had already introduced and had already rolled out and were working fine. Again, before COVID, we were meeting in person. We wanted to make sure that we didn't lose anything with this isolation, with this these stay-at-home orders. So we decided to go virtual. As a matter of fact, under Larry Scott Walker's leadership, as far as Thrive is concerned, we are all virtual. We are all working from home. Our building has been closed since early March, but we haven't lost anything. So one program that we have is Roundtable. The word Oba means king in the Yoruba language. It means ruler. And so we would have Oba's roundtables because we think of all of our members as kings, as rulers. And we would have good old-fashioned rap session. Right? We would talk about anything from finance, retirement, to sex. And during these sessions, the guys get to know each other. We get to hang out. We formed a bond. We formed a family. Now we're inside. Everybody's in their own home. So what we decided to do was not only have these sessions once a month, but we had virtual sessions every week. So every Thursday, we're on the phone, on a Zoom call, and just having a conversation with our members so that they don't feel as isolated. And then we added another session on Tuesday nights. You know, a lot of us would normally be at a bar hanging out with each other. And so we decided to have a virtual happy hour. And, you know, that happy hour is growing and growing, and we don't have a set topic. It's just grab a drink, come on in, and let's talk. Normal programs is called the Silver Skills curriculum. And we have 3 cohorts running, and we train the men in our group about aging. We train them about PTSD and trauma, loss and depression. And then we end it with stigma, because as Larry mentioned in his opening, as Antoinette mentioned, stigma is devastating, and there are all types of stigma. So we talk about those types of stigma, and then we do some things to try to get guys to see and to own that. We end it with a photo shoot, and in this photo shoot, we take those pictures and we use those pictures to inform some of our I Thrive campaigns. And I don't know, many of you are probably seeing our I Thrive campaigns throughout the country. We usually release them on HIV and Aging Day, HIV Awareness Day, World AIDS Day, and we also release them on Thrive SS's anniversary, which was actually Monday. So we release those pictures because there's nothing better to kill stigma than to say, you know what, I'm living with HIV, but look at me, thriving, doing well. And that has been a great success for us. So before COVID, we were focused on mitigating mental health disparities. And now we are even more on what we need to do because we don't want to lose any of that ground that we gained. So resource page, we talk about Thrive as a resource, and that will come on the next page. But all international resources, the CDC, the HHS, and there's a link there for those resources. And your Congress, your senator in your state, whether it be your state senator, your state representative, or your U.S. congressman, congresswoman, senator, and they don't have any resources for you for COVID-19, you need to think about that when you go to the polls in November. I went to my congresswoman's website, and she had a great link, social distancing apps for seniors. Since I represent a group of guys over 50, that was really important to me. And there were great apps in that link for people over 50, not just people living with HIV, but people over 50, and what to do during COVID-19 and what to do while sheltering in place. So next slide, please. As I mentioned, the Silver Lining is a program for Black men living with HIV, created by Black men living with HIV. And shout out to my co-writers, Nathan Townsend and Claude Everett Bowen, who helped me write the program. Shout out to my two program coordinators, Daryl Branch and Joe Robinson. You can reach us on Facebook at Silver Lining Proj, on Twitter at Project_SLP, or you can always go to the Thrive website, thrivess.org/SLP. Thank you for listening. And I hope the information that I gave was helpful to you.
Thank you so much, Malcolm. Thank you so much, not only for this presentation, as it was very resource filled, but also your commitment to championing for the best of your community, as being a long-term survivor living with HIV, but also as a person over 50, as a Black person, understanding that those varying intersections, we talked about intersectional stigma earlier, but those varying intersections also leave you highly susceptible to succumbing or being hospitalized due to COVID. Looking at the numbers, I love you. And I will talk to you in a minute, I'm sure, after this call. Yes. Freda Jones is a 17-year survivor and thriver living with HIV. She committed herself in the 90s to supporting other women specifically and other people highly marginalized with HIV and navigating through their process as a person newly diagnosed or just struggling with their HIV status. Freda is the executive director and founder of Lotus, which I butchered the acronym earlier, so I will not do that today. And it's here. It's loving ourselves through unity and strength. I knew. I was trying to touch y'all. So Freda is also a person that I love greatly. Lotus, Thrive is honored to be the fiscal sponsors for Lotus for the next 2 years as we build the infrastructure to push them out into the streets. We love our sisters, and I'm honored to introduce to you all Freda Jones.
Thank you for having me. Thank you guys for having me. And thank you everyone for allowing me to share this platform with everyone. So I will start
real quick, Freda, I'm sorry. I apologize. moderator fog. For everyone, our presentation, we understand that we are running a little long. We invite you to stay if you can, because we are very intentional about answering the questions that you may have in the place inside of the chat box or the Q&A. But if you have to jump off, understand that these slides, as well as this video and the information linking you to these professionals, will be available afterwards. Thank you so much, and I do apologize, Freda.
No problem at all. Yes, so to reintroduce myself again, as Larry said, I'm the founder of Lotus, which is Loving Ourselves Through Unity and Strength. I have been diagnosed with HIV for 17 years. I came from a family of 6 girls and 2 of the oldest, which were twins. And they passed away 6 months apart due to complications from the virus. When I found out my diagnosis, I knew I wanted to make a difference in the world and to be that support to other women that was diagnosed as well. In my 17 years of thriving and surviving with HIV, I have decided to start a private group on Facebook for women that's diagnosed with HIV by the name of Lotus, as I said earlier, which now we have nearly 300 women that are thriving as well with HIV. The group is a diverse group for newly diagnosed to long-term survivors of HIV. And they're aging very well. Since the group was created, we have had many success stories. That's what I love so much about this group, is because we have many success stories of women maintaining an undetected viral load for the first time since joining this group. Yes, since they joined the group, they maintained undetected.
To Alphabet or anything Friday? I mean today?
We have women that
I'm
are
sorry,
more.
Malcolm, please mute your line. If someone can mute Malcolm's line, can I do that? Someone mute Malcolm's line, please.
Thanks. Bye.
Malcolm, please mute your line.
Okay. We have more women that are more comfortable with not only their family and their friends, but they also are comfortable now with letting the community know about their diagnosis. Our vision is to change the way the world view us as we are surviving, thriving, living well with our diagnosis. Today, I will speak to you about long-term survivor of women and HIV and their thoughts on COVID. I will also talk to you about the prevention of COVID versus the prevention of HIV. And my final part, I will talk to you about self-care and COVID-19. Next slide. Black women with HIV and their thoughts on COVID-19. Like I said earlier, I have a group of nearly 300 women, and they were surveyed to obtain their thoughts on COVID-19. Next slide. The question that I asked is, are you comfortable going out with the threat of COVID-19 and your HIV diagnosis? I had 56 other women to respond to that for me. And greatly, 91% of those ladies are long-term survivors. Long-term survivor could be several number of things. You could be long-term survivor from HIV itself, or you could be, I look at it as a definition of just surviving. It could be you survive from childhood, you surviving alcohol abuse, drug abuse. So, but these ladies are long-term survivors, which is classified as 5 years or more of being diagnosed with HIV. So I have some wonderful ladies in that group, and 71% of them said yes. They do have a fear of going out in the public, and I will tell you later on about some of their fears of it. And 29% of them said no, that they was not afraid. And they also, later on in the slide, I'll tell you why they said they are not afraid of going out, and it being a threat to them. Next slide, please. I also did a questionnaire, a survey, and asked them, in which domain are you experiencing the most COVID-related stress? We know that COVID can be a stress to all of us now. Some of us are experiencing mental, physical, emotional, spiritual, or all of the above, and some of us are not experiencing any of the stress at all. Some of us choosing a way of how we want to experience dealing with the COVID-19. 41% of the ladies that I spoke to that experienced some of the stress, some of the mental stress part can be fear or worried about your own health, and not only yours. If you have family members, you are also worried about the health of your loved ones, and can you care for them? I have one young lady that cares for her older relatives, her grandparents, and it's hard for her, but she knows she has to do that. And I'll share one of her thoughts later on as well. And also in that mental, you have to change your sleeping habits. Sleeping is a mental, like if I don't get enough sleep, there's a problem. So changing that, your sleeping patterns and your eating patterns. I see now where most people are saying they're gaining some weight. That can bother you mentally, knowing that, oh my God, I have gained all this weight. And then when I gain all this weight, I'm going into some other things. I may start smoking more. I may use alcohol or any other drugs. So mentally, it can get to you mentally. And that's what they were saying. Worsening of chronic health. Your chronic health, it can even get worsening. So those are some of the things, and even with the mental health, the mental can even get worse. So those are some of the concerns that they had when it comes down to the mental. Physical health, just because we are diagnosed with HIV and long-term survivors, we may want to do some physical things. Some of us exercise. Some of the ladies, I didn't say I do, exercise. Some of them have a walk. They go and they walk together, even when it comes down to the emotionals. Because sometimes when some of the ladies are diagnosed with HIV, there's this isolation that you may feel. You're already feeling alone, and it can be emotional thing. Oh my God, I don't know what I'm gonna do. Some of the ladies, they come in the group and they share because they can. That group, they can share whatever they want to share. And they share the emotional feel of it. I'm about to break down. I'm having anxiety. This is really hurting me. So they are experiencing the emotional. Some people spiritual. They don't have their prayer partners. They don't have the regular sisters that they talk to on the Sunday mornings, or who they pray with at church. Having that that one-on-one contact. They are not having that. So they are experiencing some um, spiritual stress. 5% of the ladies said that they are experiencing all of the above: the mental, the physical, the emotional, and the spiritual. But we also have some that said none. None. They are not experiencing any stress at all, and that's okay. It's okay not to be stressed. That is so okay. So don't get stressed thinking that you have to be stressed. It's okay not to be stressed. I took it on a way that I felt was best for my mental health. What I did was not get into the news as much. I didn't want to keep hearing it and keep hearing it, so I read what I wanted to read. So I didn't get so deep into the news because I know sometimes you can get some not well information. So I didn't. That was just my personal thing I didn't want to watch TV too much because I knew it would go to my mental. It would bother me mentally to see all the people that's passing. It would bother me mentally to see how you are now isolated from your loved ones, your family, your kids. If you was exposed, now you're isolation. Now you can't go around your kids or your grandkids. So these are the response that I got from them. Next slide, please. And I also asked the question, how are you feeling related to the COVID? All the answers came from 100% of the ladies that responded to this was long-term survivors. I'm not supposed to say was, they are long-term survivors of HIV. So it was great to get that number from the ladies. Next slide. And from that 100%, these right here are quotes that I got from the ladies that responded to that. One of the young ladies expressed that she feel that people aren't taking coronavirus serious. They are not following guidelines. She stated that she is scared and trying to practice social distancing as much as possible. That's a fear. That's a fear of knowing that you are doing what you have to do, but what are other people doing? We have to continue to practice social distancing as much as possible because you never know what the person next to you at the grocery store is experiencing or the person walking next to you. So please practice social distancing as much as possible, please. Next slide. One of the young ladies mentioned to me that she honestly don't know how to feel. Sometimes she's worried about it, and other times she's not. She washed her hands. She said she wash her hand and keep her distance, but I can't do the mask. I don't like the way it feels on my face. So that was a discussion. Also, this young lady right here, she cares for her older parents, her grandparents, and she knows she have to practice precautions. She don't like the way it feel on her face, and that's okay for you not to like the way that it feel. But if you can, please put the mask on as much as possible. Practice precautions when it comes down to taking care of your elderly parents and even to caring for your kids as well. Next slide, please. Wow, this young lady right here, this was very interesting to me. She stated that she have every emotions and really not happy on how the state opened the restaurants. And she lived there in Texas. The place is full of restaurants, so everyone out in the patios, they was enjoying themselves, and it made her feel uncomfortable because they wasn't wearing masks. And in that experience, she experienced anxiety. Because she used to go on her daily walks, and that's where she goes on her daily walks and having a peaceful moment. That's what she do on a daily basis. She has been doing it for months. And the experience she got was people getting too close to her and not practicing social distancing or even without the mask. It wasn't having the mask. I am protrude about that. They are a threat to my health and they think I am crazy in my mask. It's not fair. We are hunkered down every day and these people act like nothing can touch them. And then we can go back to that's how some of the people felt with HIV. HIV can't touch me, so I can do whatever I want to do. I can practice communist sex. I don't have to ask anyone about their diagnosis because HIV doesn't apply to me. Those are some of the thoughts that some people have. But given things, now they are long-term survivors. They know that it can touch you. Just like the coronavirus, it can get to you as well. So don't think it can't happen to you. Next slide, please. One of the young ladies quoted that people aren't taking the social distancing serious. One lady was so close to me at Walmart, I started to get up next to the cashier and ring my own grocery. Then she sneezed. I almost fainted. I have been scared ever since. Just ridiculous. This is an eye opener. She fear now of even going to the grocery store because people are not practicing social distancing. Give me 6 feet, please. Please give me 6 feet. Don't stand that close. I have a problem with people standing that close to me anyway. You know, it's not just coronavirus. Why are you standing so close to me? So she experienced this at Walmart, that a young lady was too close to her and didn't even have on a mask. So that put her in a panic mode because we also thinking about now I have to worry about this COVID-19, and I'm taking care of my HIV, but these people don't know that. I don't walk around with a mask or anything on my head saying that I have HIV. Please give me 6 more feet. You know, and that's what they probably want her to do, I guess. I'm not sure. Next slide, please. One of the young ladies quoted that being undetectable is a wonderful thing, but my immune system might say different. I'm scared. My faith in God and protecting myself is very valuable to me. We hold value. Her faith in God and protecting herself holds a lot of value to her. And that's what she holds on to, her faith in God, and know that she has survived HIV, and she's going to survive the the things that's going on with COVID-19. So she had her faith. She stated to me that she stayed prayed up, and she's not really worried about it because she's keeping her viral load undetectable. She maintains keeping that very well. Next slide, please. The prevention of COVID-19, and it's easier, people. It's easier to prevent HIV than it is to prevent COVID-19. You was fine there. It was easier to prevent HIV than it is to prevent COVID-19. With COVID-19, we have a lot of steps that we have to practice. With HIV, put the condom on. We are a society that social media is out here, a lot of research and everything. You can find it on the internet. We have to start thinking a little bit harder and a little more. It's easier to prevent HIV than it is to prevent COVID-19. Next slide, please. Self-care during COVID-19. Self-care is very, very, very important with this. With the self-care, you have a variety of things that you know you can do. The self-care, you have interaction with family members, getting out, enjoying some outside time with a glass of iced tea or your favorite drink. And we all know that music is a great thing. Music relaxes your mind, it relaxes your body. There's a variety of things. They even have Zoom games and chat with your family members. They also have where you can watch a movie with someone. So watch a movie with someone. You can watch that on Zoom. It's called Watch Together or something like that. Or have a virtual dinner date. Yes, virtual dinner date. There's nothing wrong with virtual dinner dates. Get your boo, order you some food, and get him or her food as well. And y'all sit there and have some fun together. Practice your social distancing. He's over there, she's over there, and y'all can sit there and enjoy something together. Physical distancing is not social distancing. Physical distancing is not social distancing. Remember, ladies and gentlemen, Take care of your physical health by fueling your body, by eating healthy, a well-balanced diet, and drinking plenty of water. Aim to get 6 to 8 hours of sleep each night. Sleep is very important. Take care of your physical health. Avoid risky or destructive behavior, such as abusing more alcohol or drugs or excessive gambling or ignoring the public recommendation. If you ignore it, then you're going to go into your mental. You're not taking care of your physical. Spend some time outside, walking in the park. Just make sure you practice social distancing. Also, ladies and gentlemen, please take care of your mental health. Set a maintained routine at home. So that way you won't be all over the place, getting into some different things, and then it bothers you mentally, like, oh man, I forgot this. This was very important to me. So set some routine around the house. Focus on things that you can control. Some of the things that we cannot control. Control what you can. Not controlling is in a negative way. Like some people say, oh yeah, women controlling. Not that kind of controlling, but focus on some things that you can control. Use technology to maintain social connection. As I stated earlier, there's Zoom videos out here. Zoom in your family. Get on your Facebook chat with your family members. Consider a regular check-in with your loved ones. Focus your thoughts on the present things and be grateful for today. Focus your thoughts on present things and be grateful for today. Somebody did not wake up this morning. Somebody won't be going to sleep tonight. So be grateful that you are here. Get you some great music or read you a book. Consume your reliable sources that are reported facts and avoid the media, some of the media that's just putting out the wrong type of information. But please consume you some reliable source. Consume your mental reliable sources and some facts. Limit your exposure and take a break away from the news. Like I said earlier, I don't get this is my personal thing. I have watched a good hour of TV in the past month because I don't want it to consume me mentally. Lean on your personal beliefs and your faith for support. Call up your friends, call up your family or your pastor, or call someone in the church, or you call someone. Look for ways to help your community, such as blood donation. If you can donate some blood. Checking on your elderly people in the neighborhood, or go out and donate some things, but still practice social distancing. Acknowledge and appreciate what others are doing to help you and others. Thank you guys for taking the time out. I really enjoyed this. Please, thank you.
Thank you so much, Freda, for that amazing report out, and as well as those amazing suggestions. I agree, and have snapped up so many of those suggestions that you're talking about, especially not over consuming too much information, even if it's factual information about COVID, just not inundating ourselves and flooding our minds with this information. I would like to thank all of Esfreda as well as the rest of the presenters. Now I'm going to go into a bit of the Department of Health and Human Services recommendations for people living with HIV. Again, before I start into this part, I would like to invite you all to stay to the conclusion of the presentation. We should not be that much longer because we want to get to your questions. For people living with HIV or advanced stage HIV or HIV that's poorly controlled, it is especially advised that we take extra precaution to make sure that we remain safe. Our regimens as people living with HIV, especially long-term survivors living with HIV, we should not be considering to changing our medical regimens to fit Kaletra as some form of prep for COVID, as this is not recommended. Consider the risk versus benefit of attending in-person clinic appointments. or going into your care facility at this time, and maybe considering telemedicine, as Antoinette covered earlier. And for persons who have been sustained virally suppressed for a while now, it might be time to consider again telemedicine or postponing some of those in-person appointments. As Antoinette also covered earlier, it's advised that we maintain on hand at least 30 days a supply of our medication, our ARVs or antiretroviral therapies. And if we can get it, requesting 90 days, like I have, and so many people have talked about requesting more medication so that we don't have to go into the pharmacy. Talk to your pharmacy and your healthcare providers, and they can give you more information as to whether or not you are able to actually assess multiple months of medications beforehand. And if your regimen is scheduled or due to be switched at this time, making sure that you monitor this closely with your care providers and your care team. And again, we can't mention it enough. People living with advanced stage HIV or people with poorly controlled HIV must and should take extra precautions at this time. Here I go again talking about my list. Y'all know I like to talk about lists if you were on the other calls, because lists are very valuable. Lists are how we attract what we are trying to manifest, but also it's how we don't forget what is vital. And for us as long-term survivors and people living with HIV, it is vital that we know our medications, as well as the contact information for our care providers, as well as our emergency contacts, that we have them listed as well inside on a piece of paper inside of your wallet or inside of your pocket, but also inside of your phone, just in case you're separated from your wallet. So if you're if you're a person living with HIV who is hospitalized or experiencing any type of hospitalization, or your partner, like Malcolm said earlier, shared, is hospitalized during this time, it is important that, number one, that their medication is continued. Do not allow for the care professionals to take them off or negate their previous treatments for HIV, as it is important that we maintain our viral suppression at this time. Make sure that you advocate for your loved ones, especially if it's not yourself, and if there's people in your network, and we all represent networks of people living with HIV, if they're hospitalized, making sure that we remind them, as well as the people who have the closest access to them, that their ARVs should be continued. Especially if you're a person who receives ebalizumab infusions every 2 weeks. These infusions are for people who are have various resistances and things like that, and they help people to maintain a viral suppression. And these infusions are vital. So it's important, if you're a person or are advocating on the behalf of a person who is receiving these infusions, that you contact their patient support so they can give you some additional information around how these infusions can be continued. And the most important slide of today, in my opinion, is that this slide that reminds us, though a lot about our realities, our lives are being canceled or put on hold or postponed at this time, family will not be canceled. Friendship will not be canceled. Songs will not be canceled. Reading will not be canceled. Pets will not be canceled. Community can never be canceled. Love will not be canceled. And hope will not be canceled. I want to thank all of the presenters who presented on this call today, this webinar. I would like to thank, in the order of long-term experience or experience living with HIV, my sister, my hero, Antoinette Jones, as well as Malcolm Reed, as well as Freda Jones, for sharing not only their experience, their story, and their expertise, but also their suggestions for workarounds and best practices for our community. Again, we understand that the panel represented themselves and their communities, but we understand that there are other marginalized people of all types of demographics and potentially on this call. And as such, we invite you to continue to share your experiences and hold up the livelihoods and the worldviews of your communities right now inside of both the chat box as well as the Q&A section. We are now going to open up the floor to the amazing Damon Johnson to take us into our question and and answer period. And we are here to answer all of your questions and to hear your experience. Thank you all so much. And I look forward to hearing your questions.
Thank you so much, Larry, and thank all of you, all of you all for staying on the webinar and really being engaged the entire time. I'm honored to say that we had a 78% attentiveness rate, which is really really amazing for so many people on the call, and we really appreciate that. There were a few questions, a lot of comments, and we thank you for them all. And usually, when we have a lot of comments, that means we did something right. But feel free to drop any more questions into the chat box, and we'll go from there. One of the first questions was, is Lotus just for Atlanta, Georgia residents? Freda, could you please unmute yourself and answer this question, please?
Freda,
Just,
is she still on?
yeah, I believe so.
Okay, there I go. Okay, I was muted. No, Lotus is open to anyone as long as you are born female that's living with HIV. You can definitely join our group. You can find me on Facebook up under Freda Jones. You can also find us on the Lotus on Facebook, Instagram, and Facebook group as well.
Thank you so much. To everyone on the call, we had tons of questions about sharing the webinar, the link, and the slide deck. We will be sharing both. We do an event summary. Usually comes out the day after the webinar. We share the recording and the slides. So please be on the lookout for that Monday, and you'll be able to share it and utilize it at your will. We had one of our peers on the call. He said he's a peer and he works mostly with Haitian Creole speaking patients. We discussed how to work with the Black community. How can we help those individuals as it relates to adherence and reinforcing their ARVs? Malcolm, Larry, and this is for anybody to take this question.
That's a great question. Gleaning from our experience here at Thrive and what we've been able to do, I would first start by engaging those members of Haitian experience and background to get them to assist them in building something that will work for their community, understanding that nothing about us without us is for us and will work for us. So understanding that, utilizing the best practices in community, and then also interfacing with the actual community to come up with what the remedy that is suggested and best works for that community is. We are here to support in any way that we can. We will offer TA in any way that we can, but it must start and begin and end with the community. That is the focal point. I hope that helped.
Absolutely. Okay. The next question was, do you know anything about the incarcerated population who are HIV positive and potentially at risk or have acquired COVID-19 while in prison? We had this question on another call. Does anybody want to take a stab at it? And if not, I can share what we learned from the other call.
Answer that, maybe.
Okay, so on the other on our Stronger Together Part 2, someone asked the same question, and what we learned is that there's very limited information about the prison population. There hasn't been a whole lot of information as it relates to how we're handling the prison population and COVID-19. However, we did find out there are some prisons and jails that are testing for COVID-19. So we're just waiting for that data to be released. I'll share a personal story. I have a brother that's in prison, in a Florida prison, and he stated that they've had an outbreak of 34 individuals that he knows in his dorm who've tested positive for COVID, and it was pretty surprising for me to hear. So I do know that there's testing going on. I don't know if they're promoting or disseminating that information, or if it's being added into the national count. But I do know that testing is going on in prisons and jails, and they do have a coordinated response. He said that they are isolating those. They're all on lockdown. They're on 23-hour lockdown to enforce social distancing, and that the people who test positive for COVID are being put into what they call the box, which is the hole, which is a self isolation area. But I don't know how measured the response is, but they do have somewhat of a coordinated response. Okay. I hope that answered your question. Someone asked us to send resources to them in Miami, Florida, as it relates to resources for people living with HIV and are wanting services during COVID-19. We do know that the landscape looks completely different now. So together, we've taken it upon ourselves to really garner our resources, and we sent out a survey that was a national survey, and we've collected tons of responses. And what we've done is we've curated those responses, and we've created somewhat of a guide, and we'll be disseminating that guide on Tuesday. We'll disseminate to everyone that has ever registered for anything for Georgia AIDS Education and Training Center. It's not specific to Georgia. It has almost every state represented, letting us know who's providing services, how they're providing services, rather is the best way to contact them, what are their limitations, when do they anticipate being open and fully providing the full list of services. And we have future webinars as well on how to engage in telecare and a number of other things, linkage during these times as well. Someone just asked, and this is to the entire panel, we know that drastic events cause transformation. Just as HIV changed healthcare and precautions against potential infections, in what ways do you think COVID-19 has and will change healthcare?
This is Larry. I'll start. I believe that COVID-19 has exposed a lot of the gaps and lapses in healthcare and our healthcare capacity to deal with, especially more specifically, pandemic level situations. I've heard it said that, all healthcare after this pandemic will be some form of telehealth. So I think that it did definitely change it in that way, as well as the need to partner and thought partner with clients and members and patients, people living with various disease states and comorbidities. I think that this has identified like a need to like closely have a closer relationship with your provider and vice versa to get things done, especially when you're working in a workaround, like, having to go from having in-person appointments to telemedicine and things like that. But yeah, those are some changes that I foresee.
Yeah, and I have to agree with Larry about the telehealth. My doctors had a lot of telehealth before the pandemic, and we saw it as something growing, and especially in rural areas where there are, they have to drive for miles and miles and miles to go to a clinic or a hospital. So I definitely see this pandemic advancing telehealth, and I think telehealth is going to grow. I also want to say that I think that as advocates, it's upon us to make sure that no one ever forgets the disparities that have been exposed. We knew they were there, but I don't know that the general public knew that they were there. So those disparities in communities of people of color need to be used and exploited in order for us to drive home the point that access to care, the social determinants of health, all of those things that are keeping people out of care. This is the perfect example to say, see, we weren't making it up. This does exist, and we have to drive fixes and mitigations for that as well.
Yes, I agree with the guys as well, because I know at Absolute Care Medical Center where I work at, we are doing more telehealth, and I'm really enjoying it because now I'm calling people. I can have that conversation with the members that I hadn't talked to and let them know, like, hey, a lot of us are doing the telehealth now. So call in, get your prescription, call in and make your doctor's appointment, because that was some of the barriers. You know, I don't have a way to get there. So now that's not a barrier. We can break, it's going to be in the future, I mean, again, but that's one of the things that our members don't have to worry about. I don't have a way to get there. Call them. Call your doctor's office. If you can hear me, I want you to know that a lot of these practices are going into telehealth now. If you need your medication, give them a call. Don't go without being able to take your medication. Don't go without being able to get your lab works done. All practices, the majority of them are practicing telehealth now. So please reach out to your providers, your nurses, or whoever, and make sure you get that viral load undetectable or maintain it staying undetectable.
Thank you so much for that, guys. The road is often long and tiresome for long-term survivors, and they're often in and out of care. What advice can you give to long-term survivors and providers as it relates to staying engaged and retained in care, and if they're not in care, to motivate them to be back in care?
I
Um,
would. I'm sorry. No, go ahead.
no, go ahead, Larry.
Okay. So I would say get connected to some peers. I'm a proponent, like an advocate for 24-hour advocate of support. I know what it has done for me and a lot of the people in our network. And they can't be minimized. There's a lot of power and support for providers that are providing care to long-term survivors, to make sure that we're educated and knowledgeable of the latest medical advancements. As a person who began taking medical ARVs myself, taking 3 pills a day, I feel like I was on those meds for years longer than I should have been, considering that there were, much safer and more well tolerated and more effective regimens that I could have been on. But not, I had to be the person to advocate for, this. And I think that that's the wrong way that it should be. You're the medical provider. If there's a new innovation, if there's a new safer drug, then get it to me. Make sure that I'm aware. I think that, after, living with HIV for so long, maybe the assumption is that, like, this person is well managed, this person is okay. But no, I love this question because it does hold the fact that, sometimes that is not the case. And sometimes we struggle even harder because of our maybe pill fatigue, or fatigue with just dealing with this for decades, if upwards of 3, almost 4 decades. you know um for us as long-term survivors, advocating for yourself, and if you are not connected to a network of people who hold each other accountable and hold each other up and make sure that each other are good, maybe trying to connect to some of that, and we can help you at Thrive. Another shameless plug for Thrive. We could definitely help you, because we don't want anybody out there going unsupported, especially those of us who live in rural areas, those of us who are highly marginalized, those of us who are experiencing poverty and extreme need. Just advocating for yourself and your family, and then also getting connected to some sort of care and support.
Antoinette, I believe you wanted to add something to that.
Larry actually said it. Everything that I was going to say, I was definitely going to push the peer navigator or a peer specialist, because just having someone who looks like you plays a huge role in your care, someone you can connect to. So that is definitely what I was going to say, especially for me and my personal experience. I've never met someone else who was living with HIV or even born positive until I moved to Georgia. And it was just nice to have somebody who I could relate to and who understood exactly what I was going through. So
Thank you so much for that. Um, like I said, the rest of the questions, guys, we are sharing the slide deck. We will be sending out the links. Please look in the chat box for the links to each of these amazing organizations that were represented here today, as well as the Facebook link to Lotus Atlanta. And although it's Lotus Atlanta, it's open to any woman born a female, and that they are looking and waiting to support you all. There are the links again, guys. And if you have any questions, comments, and/or concerns, Evan, I see one here missing. Please remember to add Lotus. Um, Please feel free to reach out to us, and please be on the lookout for our consumer resource guide. We have a couple of more webinars coming up over the next week, and we would love to have all of you all to participate again. Thank you so much for all that you've done and all for you guys stand on the front line and stand on this call. Someone did ask if Lowe's open to trans women. I do not believe they are, but I'll let Freda answer that. But if they are not, we have a couple of resources for trans women as well.
Yes, we do. Yes, we do.
Yes, I have. Yes, I do. Have a friend that has a group for trans women.
Thank you so much for that. Thank you all for your kind sentiments and the kind words. This really makes me full, and I feel like we really did something good. Before we end the call, could you guys send the information to me for the trans women, because we have a couple people asking about trans women. And again, thank you all for the kind words. I can't thank you all enough.
Thank you for having me.
Thank you.
Yes, thank you all. Have a great day, everyone.
Thanks, everybody. We appreciate you.